My guest today is Dr. Jack Bowman, who is a longtime clinical sports psychologist. He is also a certified sports psychology consultant with the Association for Applied Sports Psychology. He is listed as a recognized provider on the USOC Sports Psychology Registry. He has, in addition to his wealth of clinical and applied experience working with athletes, has also taught sports psychology for numerous years, over 40 years. He was instructor of the graduate sports psychology course, where he continues to work at Stony Brook College in New York. He, from 1984 to 1995, was an associate professor in psychiatry at Stony Brook University Hospital, where he taught biofeedback and hypnosis. And so it's a real pleasure to welcome you, Jack, on the podcast. And I appreciate you taking the time to meet with me. Thanks.
Well, Les, I cannot tell you how excited and actually privileged that I feel at this end. I want to commend you up front with the efforts that you've been putting in, and in terms of educating athletes and sports medicine providers, as well as really enriching and creating a much more comprehensive base of information and knowledge in the articles and the research you've been publishing, in the books you published. So I feel grateful and privileged to be here with you today and be part of your effort.
Yeah, well, and thank you for the kind words. And it's been wonderful to meet with experienced individuals like yourself who, as you mentioned, are in a position to share their knowledge and to provide credible information for practitioners, for athletes, for sport medicine providers. On that note, Jack, I know you've been involved in a lot of interdisciplinary teams integrating sports psychology into the care of injured performers well before that was even in fashion. And I mentioned in the introduction that you've taught graduate course in sports psychology for over 40 years. And I know you've worked with our longtime friend and colleague, Dr. John Heil, years ago in the book. You wrote a chapter with John about integrating sports psychologists into the care of injured athletes. So maybe you can just start by talking about what you see as the role of a sports psychologist in working with injured performers or athletes.
Well, I think the role has many hats that the sports psychologist really can and should wear. First and foremost, I think it's to bring a sense of wholeness to the process. Modern medicine today is very, kind of divided into silos. You have specialists for this and specialists for that and specialists for this. And the role of the not only in terms of the sports medicine team, but I think also in terms of just what practitioners like yourself and other people like myself can bring is to say, let's help this particularly athlete here move from patient to an active player again. That our job is to kind of help this athlete understand that this is a multidisciplinary, multi-stage process, and appreciate that right from the beginning. That even with the orthopedic surgeon diagramming, what the surgery is going to accomplish, to the physiotherapist, describing the range of motion, to the sports psychologist helping them use images to assist the healing. That this whole process be seen as like a story that all of the members of the sports medicine team were telling, with the athlete present, not talking outside the room like they do in a hospital about what's going to happen to the patient, but having the patient be an active participant, having that athlete be an active participant in creating a story. And I think that mindset, that frame of reference, that's the most important thing, is that the psychologists bring the sense of, let's open our frame of reference here, guys and gals. the fact that we're all part of this athlete's story, a story that's going to be told by this athlete for many years about how they started here and ended here. And then we want to all make sure that we give our kind of interaction and our part of the story so that the athlete can integrate them itself.
Yeah.
So it's really, I think that's the major function. The second is really kind of more specific, and that is, I think, to integrate, to be kind of a facilitator, to integrate the work of the physician, the physiatrist or athletic trainer, whatever term you want to use, physical therapist, and the team, the coach, and the psychologist, to integrate the communication system by which the helpers communicate with each other. That they basically, like in triage, you pass the information, you're passing the patient along to the next caregiver. You want to give that next caregiver the most information you can about what you've done and where that person's ready to go. And the same is true with, I think, the sports psychologist on the sports medicine team, making sure that the athlete's able to provide information to the therapist, that the physician's able to provide information to the athlete's able to provide information to the psychologist, and that information is not just in that silo, that information is available to everyone, so that the story is being told, the healing process, the rehab process and recovery process is all being told as a joint narrative.
Mm-hmm. So you've invoked this idea of the athlete story, and you just mentioned the concept of a narrative. Is that something that you use in your work with injured athletes to help
Absolutely.
them think of their recovery in terms of a story and how they want that story to unfold?
Absolutely. The first thing when I encounter an athlete who's either prior to surgery or is involved, I get where sometimes they refer to me where there's difficulties in the physical therapy process. They're not able to use the therapy to get to the next level. So they assume there's some kind of psychological intervention needed. Whether it's at the beginning of the process or the middle or the end of the recovery process, I basically present that narrative and honestly start with, a message that came into our awareness over 120 years ago, was President Teddy Roosevelt, who said, do the best you can with what you've got where you're at. Mm-hmm. That's what I want the athlete to embody, that frame of reference, that, my job is to do the best I can with what I've got where I'm at. And how do I do that? And so that's the story that I want you to be able to tell. How do I develop those three things? Where am I at? What resources do I have? And how can I do the best I can with them? And if I can create a story, if I can write that story, that script, in a way that I feel successful as an athlete, as a person who's engaging, and as an active participant in the process, if I can help them write that story and also get information from other people, get information from the physician, from the physical therapist, from the psychologist, about what do I want to put into that story. So yes, I do use that narrative model. And then, and it works up from there, Les. That quote, do the best you can with what you got where you're at. I kind of turn it upside down and say, let's start with, awareness. Where are you at? Where are you at this moment? Who are you? How do you identify yourself? Are you a patient? And what does it mean to be patient? If I'm a patient and right now I'm in the hospital, I'm rehabbing. Okay, let's learn to be patient actively. So the whole idea of being patient, that concept, wait, time heals all wounds. Yes, and what else do we want to add to that story? Can you be patient actively? So I teach them this acronym: active, awareness, control, training, imagery, value, experience, active. Teach them that how they can bring those components into their active participation as healer. So the story is, where am I? Who am I? Where am I at this point? In the process of this story, and at the beginning of the story, the middle of the story, toward the end of the story. A lot of the athletes I'm working with now in the individual consultation are toward the end of their rehab. They're coming back, and it's more of the return to play phase. So a number of them, this past semester, I've had several athletes who are returning to play. This is going to be their first time back on the field, and maybe sometimes 6 months, sometimes a year and a half. It's an ACL reconstruction. But where are you at in this story? what's going on around you? You know, what kinds of awareness really asks, who am I? Where am I? And how do I want to view my situation? Do I want to view my situation as, do I want this to be a story of a victim? Oh my gosh, this poor me. Or do I want to be a story of a survivor who thrives? I survived this and moved on. And so how do you want this story to be written? So yes, I engage them right away to say, look, this is your story. Many times I'll say to them, this is your story. What do you want to write in it? What do you want to write in it today? What are you doing today at this moment to bring this story to the fulfillment that you would like it to see? So I put the onus, say, look, you're an active participant in this story. But that's the idea of communicating. For instance, with athletes, to give you an example, when they're going in for therapy in the training room, which requires some kind of treatment of manipulation, where a limb, a shoulder, a knee needs to be manipulated, and so that there's pain involved in the therapy because they have to extend the range of motion. I engage them in a process called the pain contract. So this is a perfect example of the communication I'm talking about between all members of the sports medicine team. I engage them in a process called the pain contract. And the pain contract is such that the athlete says, where am I on a 0 to 10 scale? You know, in terms of being able to handle the degree of pain that I may require in this therapy session. Don't go in there afraid, go in there with a plan, go in there with a message. And so here's, so on a 0 to 10 scale, 0 is, I can't handle it all. I didn't sleep at all last night. I've stressed to the max. I have a cold. I feel like just terrible. I just can't even imagine going in and feeling any pain. That's 0. 10 is, I'm going to break the wall down, bring it to me, bring it all the way to the floor. Give me as much pain as you can in this therapy because I'm ready to take it on. And you go into the therapist and you say, here's my plan. I know we're going to do this today. I'm prepared to handle level 5. I'm prepared to handle level 7. Okay, Mr. Therapist. Okay, Mr. Physiologist. What's going to happen here? So then that therapist says, okay, fine. Level 5. When you get close to 4, let me know. When you get to 5, let me know so I can begin to back off. So first the athlete creates the contract with themselves, and then they communicate that contract with the physiatrist, and then they have a joint contract to say, this is how the pain situation is going to be handled today. We're communicating together. I'm communicating my capability with you. You're communicating your ability to understand and work with me at that level of capability. So therefore we have a contract. So that's an example, as I was saying earlier, about the role of the sports psychologist in the sports medicine team is to facilitate, to build vehicles, and to encourage this kind of communication from the athlete to the caregiver, from the caregiver to the athlete.
Right. And is the idea of the contract also to not only facilitate communication, but does it have motivational implications?
Absolutely.
Mm-hmm.
Absolutely. And I think, in a lot of I've listened to some of the podcasts you did with John recently, Dr. John Heil, and the importance of, the role of the sports psychologist to have the athlete perceive themselves as empowered.
Right.
I have control over the situation. I am competent. I'm connected. Those 3, I call it the 3 C's. I know that in terms of, the theory, theoretical, it has different terms, but I call it 3 C's: control, competency, connectedness. And if they have those 3 things going, then obviously the athlete's much more motivated, the self-determination theory, much more motivated to go into that physical therapy session, as opposed to, I don't want to go in today because I'm going to feel pain. Hey, I'm going in there with the situation under control. I know I'm already registered and agreed to the level of competency that I'm going to bring to that situation. And I'm connecting that message to the therapist, and the therapist is connecting back to me. So in that one example, the 3 C's are checked off: control, competency, connectedness. And that therefore, it's not just the communication method, it's also to allow the athlete to realize, I can bring this sense of agency into the situation and steer it in a way that's best for me and the entire treatment process.
Yeah. And I suppose, when you emphasize that idea that this is your story, it seems like implicit in that is what you're just talking about now, the idea of agency and control, right? Where the athlete then is the message that's being reinforced there is okay, well, I'm an active participant, as you said, that it's not just, I'm left in the fate of the hands of rehabilitation providers or circumstances beyond my control, but the things that the athlete is doing, actively doing, may make a difference or will likely make a difference to the outcomes they have or the story as it unfolds. So just going back, Jack, to your point earlier about kind of finding out where the athlete is at currently. And you mentioned different stages of recovery. So in the initial stages, do you find that athletes sometimes have difficulty accepting where they're at or have difficulty coming to terms with the fact that they've had a newfound injury or that, maybe their status has changed if they had an acute injury?
Absolutely. And I think, when we also going back to your original question, Les, I think it was a very good question. What does the sports psychologist bring to the sports medicine team? And when I think of the team, as you probably have heard already, or that I've inferred, it's not just the health providers, it's also the athlete themselves as part of the team. Mm-hmm. So we say you're part of the team. And in that regard, we want to educate them to say, how can you be a better member of the team? And we want them to educate us with their information. But the thing that going back to where they're at, we will get to this again eventually, but in the program I created for introducing injured athletes to the concept that there's a course, there's a journey that they're going to take through three stages of the process: the emotional reaction to the injury, the motivation and pursuit of the rehab and the recovery period, and then the preparation for them physically and emotionally to return to play, to enable them to feel capable of going back, in a confident and way that they perceive themselves as capable without being re-injured, and also performing in a way that they had performed before they were injured. That those three stages are part of the journey that the story is going to be written. It's like, first we start in the jungle, which is all old things are coming at us. What's this? And oh my gosh, where did this feeling come from? Then we get into the plains where, it's a long journey every day. We got to keep hiking. And in the recovery, the rehabilitation phase through the physical therapy. And then there's the return to play phase, which is kind of like going through the mountains up and down. What's going to happen? Oh, this was good. Oh, this didn't go so well. How do I handle that part of the journey? So yes, I try to give those analogies to them so that we can say, where are you? And especially in the emotional part, as you said, that at different times, that emotional reaction to the injury isn't just in the very beginning. When they come back, I've had an athlete I was working with recently who came back after a year and a half with several setbacks with her rehab on her ACL, soccer player here at Stony Brook University. And she, after the first 2 weeks, where she had contact with the ball, not just the running to get the knee ready, but where the ball was impacting the foot, her knee swelled up again. She had to get off the field once again. And that emotional reaction to, I was there, I could taste it, I was on the field, and now I'm off again. I'm back in the rehab room, back in the training room. How do you handle that? So giving room and acceptance. And I think that's also part of that. They said, what does the sports psychologist bring to the team? It's the sense of being non-judgmental, understanding that there's a whole range of things that people are capable of feeling, all of which are perfectly acceptable. So that, whether they're fearful, whether they're angry, whether they're depressed, whether they're anxious, those things all count. They're all part of what the athlete has to experience. Accept that, be understanding of that, treat that emotion and that experience that the athlete is having kindly, so they can treat themselves kindly.
Yeah. So I was just going to ask, and you started touching on this, but how do you help an athlete accept an unwanted event? So of course, for many athletes, injury is not something that they would wish for. It clearly can be disruptive physically, psychologically, in terms of their goal pursuits. how do you help move an athlete to that place of acceptance of something that's clearly very unwanted or typically unwanted?
Well, that's an interesting concept and a question, I think, because the question infers that there is some state of acceptance, some emotional place that people say, I'm accepting it. And I'm not quite sure that that's the reality of human experience. I believe that, but I'd like to just address this for a minute. If we look at the athlete and educate the athlete, what I educate them on in the active process, the acceptance awareness process, part of that awareness component is helping them become aware of who they are, not just as an athlete, not as a person, not what do I do, but who am I? What makes me up as a human being? And I educate them onto what's called the parts model, that all human beings are made up of millions and millions of different parts. There's a part of me that can be happy, a part of me that can be sad, a part of me that can be enraged, a part of me that can be very serene, part of me that can say, I accept this, and a part of me that says, I can't stand it, I hate it. So that there are billions and billions of different parts, physiologically, emotionally, spiritually, and who knows on what other, quantum physics levels we exist. Billions and billions of different parts. And that all of these parts, this comes from the Dr. Milton Erickson's work in medical hypnosis. All of these parts have intention. They're all trying to help you in some way. So I actually created a workshop that I gave in ASP back in the late 90s in Ottawa on the parts model for assisting the healing process, where I taught the athlete. They actually had the sports psychologist in the conference all sat around in small groups, and they all had the roles that they played. I'm going to be the angry part. I'm going to be the hopeful part. I'm going to be the pain part. I'm going to be the part that says I can be serene and disconnect from the pain. And we had all those parts talking to each other sitting around, communicating with each other as to what do I need to tell the other part. So when you say accepting, I really don't think that it's a state that somehow we find I'm in acceptance. Now, what I try to encourage the athletes to do is to say, be in touch with all of your parts. So that imagine that each part is a player on a stage. And so teaching the mindfulness that there's a part of the mind that notices what I'm aware of. There's two parts to the mind, the noticing part and the experiencing part, the chattering kind of flow of things coming in and out of thought, a feeling and awareness. Oh, I hear a bell over there. That's the chattering kind of note part that has all the information coming in. And then there's the part that says, I'm aware. I'm noticing what I'm paying attention to now. I'm aware that I'm having this conversation with Les. I'm aware that I'm wearing a checkered shirt. That part that's aware, the awareness part of the noticing part, that part is the director. And so at any point in the rehab process, and from the beginning to the very end, what parts do I want to bring onto the stage? So there's a part of me that says, I'm so angry. Okay, let's put the anger. Okay, you can step over here, be center stage, angry part. You're going to be, I'm angry this is happening. And at the same time, here's this part that says, hey, we got to move on. We need to kind of get down to brass tacks here. We have to focus on getting this therapy done. We got to focus on getting our rest. We got to focus on our nutrition. This is the task-oriented part that says, this is the brass tacks. This is how we're going to get better. These two parts have a conversation. Have them have a conversation. This comes from a field called Gestalt therapy, where the Gestalt means the whole. Right. Let these parts communicate with each other. Let them. So that's how you work it out. You don't say, somehow I'm going to miraculously accept this. No, you let your parts have this interaction so you can come to some resolution. So this is where I'm at. These parts are going to be more predominant. These parts are going to move back to the back of the stage. And that's how you handle these situations. That's how you help them, because you empower them to use this concept of their mind having different ways and themselves being able to embody different parts. And with that, with all parts having positive intentions, it brings also the whole sense of equanimity, that everything that happens in this situation, everything that happens between the time I get injured and the time I'm back playing, which I call kind of coming from into under the dome of feeling to out of the dome of feeling. It's a concept we'll talk about in a minute. But everything that happens there, whether I react now that I came back and I was going to play, but now I'm not. Every single thing that happens is part of the story. So it has meaning. It has a place. It's supposed to be there. It isn't like, oh, I wish I wasn't having this thought. It's part of the process of your healing. It's part of what's going to happen under that sequence in the story. So we make room for these things, and we kind of allow them to be there in a non-judgmental way. So you hear there's a lot of terms here, Les, that are coming up that obviously you've heard from people that you work with in mindfulness. That's a very important skill and strategy to help the athletes in the process.
Right. So you mentioned mindfulness, and I guess to that point about the noticing component or part of the self, just to reiterate what you're suggesting, when the noticing part of the self is aware that there are maybe different thoughts, emotions happening, some of which may be congruent, but some of which may be entirely incongruent. So for instance, maybe there's part of you that's accepting of what's happened, but maybe there's part of you that's entirely frustrated and still upset. And that awareness part allows you to then take a step back and to notice that maybe there are some incongruent thoughts or emotions, but to then make more active choices about which of these experiences, thoughts, feelings do I want to let guide me or lead me moving forward? Or, I understand and I'm aware that I'm feeling different things, some of which may be inconsistent with one another, but I'm going to sort of, that noticing part allows you to see that or observe that, and then to make choices about which of those elements or feelings, thoughts, experiences you want to, I guess, give more weight to or focus in on or hone in on to let you sort of then guide your story moving forward. Would that be correct?
Absolutely, Les. I think you really described it in a very functional way. However, I'd like to make one small adjustment to your description.
Sure.
And it's a very, in that creating the mindset for success, being a successful navigator, a successful journeyer through the stages of the injury to recovery to rehab to replaying, return to play. Being a successful person in that journey, one of the most important skills, if we go back to do the best you can with what you got, where you're at, where am I at? How do I want to view the situation? What's the frame of reference? If I use this parts model frame of reference, then that's part of accepting who I am. And then the second question, and what do I've got? Do the best you can with what you've got. What's available? What knowledge? What strategies? What skills? What capabilities? What's within me? My abilities. One of the things in terms of reframing, I like to bring the athletes right away into the idea of this process, this story is basically the game of rehab. Put up the framework. You're an athlete. You know what happens from the time the game starts to the time the game ends. What are you bringing? What intensity? What focus? What commitment? What ability to disconnect from other things that are going on because you really have to focus on just the right thing. So bring those same abilities to the rehab process. What you bring as an athlete, reframe it into the game of rehab. That's the first thing that you've got. What are the strategies? What do we know about the importance in the book you just wrote, that you edited and published, the one that you just sent me, the fourth edition? There's a chapter there on the power of imagery, the importance of imagery. You have the ability to imagine. You have the ability to set goals, meaningful goals for yourself. You have the ability to talk positively to yourself. You have all these skills that have been honed over the last 70 years in this field, the science we call psychology of sport and performance. All of these resources are available to you. So do the best I can with what I've got. And then how do I do the best I can? So doing the best I can means having a mindset for success, knowing that I'm giving it my best effort. And I would like to go back to the idea of success, because this goes back to one of the things that John and you talked about in that interview recently that I was listening to on the podcast, how in sport, this kind of underlying sociological meaning of what's successful to the athlete. You have to win, you have to push 100%. This is what that we kind of say, let's reframe that. And let's reframe it right from the very beginning. In the website I just created for the athletes at Stony Brook University, which is available honestly to anyone in the world, all you have to do is enter your email address and your own password. So you don't have to have an ID from the university to use the website. It's called successinmind.me, successinmind.me. At the very front format on the landing page, it says, what is this website about? It says, and it takes John Wooden's quote, success is the peace of mind that comes from the direct result of a sense of self-satisfaction, knowing that you made the effort to become the best you're capable of becoming. Success is the peace of mind that is a direct result of the sense of self-satisfaction. It's not some standard you have to reach. It's not something anybody else's expectations. It's your own sense of self-satisfaction that I'm doing the best, I'm being the best I can be, bringing the best effort into this healing, being the best effort into how do I cope moment to moment with this throbbing pain in my knee post-surgically? How do I cope with the fact that, it's 6 weeks and I'm still at the same level, in range of motion in the training room? How do I cope? So peace of mind that I'm doing the best I can in every one of these situations to be the best I can be. So with that concept, I think what I'd like to do is make sure that if I'm going to be the best I can be, use all of your parts. So the one thing that I wanted to take issue with was when you were giving that example is you said, well, there's this one part, but there's another part. There's no room for but. There's no room for but in the healing process. The word but has to be eliminated and it has to be substituted by the word and. And here's a part of me that's confused. And here's a part of me that's a little clear. And I'm also thinking this, and this part's available. This is all who we are. One part of us doesn't negate another part. So that's a very important, when we say, with what I've got, that's a skill that I teach the athletes right in the very beginning. One of the first skills, substitute the word but and bring in the word and all the time. Be inclusive. All these parts are part of who you are. All of them have an equal valence, not this but that, it's this and that.
Sure. Well, I mean, there's a lot of things, I guess, again, thoughts, emotions, physical bodily sensations that are swirling around in the individual all at once. And those things are not mutually exclusive, or, as you say, they're kind of maybe circulating simultaneously. And I guess it's about kind of how do you navigate all of those things that may be the different parts of the model that are operating simultaneously. And so I just want to touch on, you mentioned, Jack, the analogies earlier, and I was just curious about the role of analogies for you in the work that you do with athletes.
Oh, well, I have to say I'm highly, highly prone and very biased toward analogies and quotes as well, Les. Just from my background, in my clinical background, I've been trained in Ericksonian hypnosis. I'm a practitioner of Ericksonian hypnosis and Ericksonian hypnosis, which is basically the type of hypnosis that's applied by using metaphors, analogies, so people can create models in their mind. They can create images and allow themselves to kind of move into those images rather than using words. So metaphors, analogies are very powerful ways for people to understand things and to process things. So I use them quite frequently.
And I like also, Jack, your point about success, and it seems that you would advocate a very broad definition of what it means to be successful. And you talked about the 3 phases where in the return to sport, perhaps for many athletes, a key goal might be to return to some level of pre-injury performance, but, not necessarily. And what that might be could certainly vary depending upon the individual. And as you've emphasized, where they're at a given point in time. So I appreciate that kind of emphasis on broadening the notion of what success means and what it might be for different athletes.
Can we stay on that for a minute?
Yeah, please. Yeah.
That's a very good point. And I'd like to bring it to an applied to say, well, how does that actually work in the work I'm doing? How does it actually look? What is it if we had content on it? For instance, in the return to play phase, I know that you have had many conversations that are, from athletes as well as, mental health and physical health practitioners to say expectancies are so important in the rehab process. Like, what am I expecting in the very beginning? What am I expecting here? What am I expecting when I return to play? So obviously that's critical in terms of what the athlete's saying. Am I successful at meeting my expectations? And so at the return to play phase, the very first practices, when they first actually go back into the pool and they're actually swimming for time, where they're touching a ball for the first time, they're actually beginning the process of engaging in the act. They're not just the physical activities of the range of motion and these things. Their first practice is back. I have a thing called the 75% rule. So the athlete talks to me and describes and describes in writing. They have to write it. Here's me playing at my best before I was injured. Now, if I could see myself at 75% of that, what would that look like? How many times would I miss the pass? How many times would I, maybe not see the open field? What would it look like if I were at 75% of my maximum efficiency? And I said, okay, let's see if we would 70%, so that we create a picture of that as an expectation and say, would that be something you think you could successfully do in this first practice back? And then I think we're probably more like 70%. Dr. I think we'd be more like 78%. So they create this level of expectations for themselves that is realistic, that's based on what they feel. And so that the idea of, so success would be, and the success is not so much what they're doing in the playing field. The success is when they come back into the next session and say, I said, how did it go? I was able to keep in mind, go at 78%, go at 76%. I was able to stay focused on that, keep that as an awareness during my practice, and it went really well. So they're not focusing on the specifics. They're focusing on, again, their capacity to control the experience, their ability to enable them to actually, in that, it's not like the situation controls me and did I do well or not, did I win or succeed or not. It's, I am successful if I have mindset and the right awareness to the experience, then I see myself as a success because I've kept that awareness of the 75% rule during the practice. So it changes the context in which success is interpreted or defined.
Yeah, I think that's such an important point, that interconnection or link between how people, or whether the athlete perceives themselves to be successful at a given point in time, and what their expectations are. And I guess so much of the work that we do, or maybe part of the work that we do in a practical or clinical sense, is helping athletes to think about what some of their expectations might be, or what's reasonable, or, because certainly, and to provide education. I know when I speak with physiotherapists or athletic trainers, they continue to highlight that importance of educating the athlete and say, okay, well, if you expect that you've had an ACL and you're going to come back in 3 months, that expectation might lead you to feel that, when you're not anywhere near that goal, that you might feel frustrated, that, perceptions that you're not necessarily successful. So providing education, helping athletes frame expectations about what's, feasible, but still, maybe sort of pushes them a little bit, as you said, with that athletic mindset. Certainly the goal often is to, don't hold me back, but also to manage those expectations, influence, modify, shape, I guess, those expectations so that the athlete is more inclined to see themselves or perceive themselves as successful. I think that's a great point. Earlier, you mentioned the active acronym, and you mentioned a number of, the different elements of that. And I was hoping that maybe we could touch on those components. Some we certainly have already, awareness being the first one, but, maybe we can touch on some of the others, control. Please, if you would, Jack, it'd be great to hear your thoughts on those elements in the active acronym and how you implement them in practice with the athlete.
Well, the acronym itself, ACTIVE, is really, and I like to use acronyms with athletes because it helps them have a structure. They say,
Sure.
okay, what am I doing? Am I using this? Oh, I can use this part of the structure. I can use this part of the this process. And I think that that it starts with awareness. It's not only, who am I and what am I, what resources do I have, as well as what plan do I want? How do I want this story to be written? So if I want this story to be written, am I going to use the pencil? Am I going to use a pen? Am I going to use a keyboard? What method am I going to use? So the idea of awareness isn't just awareness of the things we've talked about. It's also an awareness of I'm in a situation, I have these resources, and here's my plan, a plan. In treating anxiety, just to stay with that for a minute, patients say, oh, I'm so anxious, Dr. B. I thought about this, and then what if this happens, and if this happens, and what if, and then this happens, and what if? So I say, oh, so you're in this what if cyclone. And in the what if cyclone, it just gets bigger and bigger, and you get more and more pulled in. You start feeling more and more anxious. You start thinking more and more anxious thoughts. And I said, okay, what can we do about that? So he said, when you see yourself starting the very beginning of the what if cyclone, say stop. I'm going to say, instead of what if this happens, I'm going to say, when this happens, what's my plan? So we substitute what if, and we put in when then. We take what if out,
Right.
when then. When this situation should occur, what's my plan? That is a tremendous way of treating anxiety. Patients respond extraordinarily well because knowing they have a plan. If I'm in that situation and here's my plan, it's not like, oh, what's going to happen? What? No, it's this is happening, and I already have a plan for it in place.
Yeah.
So that is one of the things that we talk. That's the reason that I have the acronym. So that this is my plan. Here it is. ACTIVE. That's my plan. So when I get in a situation, where do I go? What do I reach into my plan that can help me here? It's not like I'm on my own. I have a plan.
And athletes, of course, are used to having structure and plans, right? And, as you suggested earlier, that's part of adopting the athlete mindset, right? Like all the skills that they already have within them can be transferred to this specific context of rehabilitation as your new game, your new competition, right? So, right.
But going back specifically to the active awareness, who am I right now? Where am I right now in this situation? How can I view the situation that's best for me? Expanding that sense of awareness. C, control. Control the things that I can control. I can't control what's happened. I can't control other things around me. I can control myself. I can control what I think. I can control my feelings to some degree using the cognitive theory of emotion, that we feel about something the way we describe it in our mind, not the event itself. The ABC model, I can control my thoughts, I can control my emotions to some degree, but the most important thing is I can control my behaviors. And under the C of control, the most important thing is getting the athletes to write a weekly goal plan. A weekly goal plan. Back in the 80s, I first came up with the goal setting worksheet for the rehabilitating athlete. Now that plan has been subsumed for all athletes, and whether you're injured or not, it's called the weekly goal success plan. And so they have to structure exactly, here's my vision for the week. Here's my vision. It starts with a vision. How do I see this week unfolding? How does the story unfold? And what do I need to do then to bring it about? What training goals am I going to accomplish? And if they're on the field, they have specific training goals for practice. Now the training goals are do the extra band 3 times, during the day. What am I going to do to bring about my physical PT training that I have to do at home? What am I going to do to bring about my mental training, increasing my imagery, learning mindfulness, learning relaxation techniques? What am I going to do to bring that goal about? What am I going to do to achieve my academic goals? If the athlete is a student athlete, how am I planning on spending my time and blocking my time? Am I going to get the reader? Am I going to get the note taker from the class that I wasn't able to attend because I'm in the wheelchair? When am I going to meet with them? What is my goals for retaining my academic? When am I going to do my work with my physics exam? When am I going to plot it out? This is what I'm going to do during the week. And then most importantly, not at the end, but not necessarily the least, recreational fun goals. What am I planning on doing this week that's going to be fun? What movie can I watch? who can I text or have a FaceTime with that will, a person I haven't seen that's across country in Stanford that I haven't spoken to, so I can enjoy that time with them. So training goals, mental goals, coursework, academic goals, and recreational goals. That is where the control comes. They can write those goals, their goals that they think they can accomplish during the week. They're controlling their week. They're controlling that week. They're not saying, what kind of week is going to be? I don't know. No, I'm taking control by writing the goals at the very first, before the week starts, at Sunday night. And then the athletes that I'm working with, they text me those goals. I look at the goals, give them feedback. So we're on the same page. Remember I talked about the communication always between the practitioner and the athlete. I'm aware of their goals, and I'm aware of what and I can give them feedback and also check on how they're doing on their goals across the week. So the C stands for control, what you can control. Goal setting is very important there.
So before you go on with the train, Jack, I just want to ask you about a point you made about control. And you mentioned a particular focus on controlling behaviors as being particularly salient. But you also mentioned this idea of controlling thoughts and emotions. And so I wonder also from, we've talked about this idea of mindfulness and being aware of thoughts. And I know from that sort of philosophical standpoint, there's the suggestion that, well, one can't necessarily control thoughts, or the goal isn't to even try and control thoughts. So I was wondering if what are your thoughts there? Is there some inconsistency there, or is the maybe there's the suggestion, I guess, in mindfulness that, well, I may have negative thoughts that pop into my mind. Mm-hmm. My goal isn't to try necessarily push those out, because that's inevitable that I may have negative thoughts, or that but maybe the goal is to create some awareness of those different thoughts that are happening. So maybe you could just comment on that.
Well, that's a very, very broad and very important question. I think I'm going to have to just
no worries.
Have its own, let it transpire its own little story there. The idea of controlling thoughts and emotions is a very important one. And, we can look at the work of Stephen Hayes in the ACT, acceptance and commitment therapy body of work. And I think you did, however, if we want to get away from the larger, kind of scientific ways that are provided now for us to be more in control, and just kind of get down to the brass tacks of things you mentioned. Number one is the cognitive theory of emotions. I teach them that. What do our feelings come from? The ABC model, A, B, C. This is a theory that was developed about 50 years, 60 years ago. It's the primary vehicle by which cognitive behavior therapy works. An emotion is just not something, this event occurs and all of a sudden that creates this emotion somehow. So that event gets into me and I have an emotion. I feel an emotion. The emotion is a byproduct. There's 3 stages. First, the antecedent event. Here's the event. B is the belief. What am I telling myself about that event? C is the emotion. Okay.
The consequence, which is the emotion.
The consequence. Right? The C is the consequence. So the emotion, so that be aware of what you're telling yourself about the events. One of the strategies that I teach them, what do I have at my disposal, is what we call optimistic reappraisal. Right. Find something useful or beneficial in every difficult or challenging situation. So if you look at the situation, oh my gosh, my knee is throbbing right now. And I said, oh, that's the worst thing that can happen. This is terrible. My knee is throbbing right now. Well, then you're going to feel anger or frustration or rage or sadness. Right. If the knee is throbbing right now and you say, find something useful or beneficial in the situation. Here's my chance to use my hypnosis for pain management. Here's my chance to use that hypnotic technique. I'm going to put that audio on that I work with Dr. B, and I'm going to manage it. Good, because I didn't know if my knee was going to be hurting this week. We had that technique, but here's my chance to use it. Then you're going to feel a sense of optimism, curiosity, instead of anger and fear and sadness. So we teach them that. So that's when we talk about the C in control. There is some vehicle, there is some body of work where that sense of control can be applied. The other thing is that when you're having random thoughts and things coming into your mind, way that we can perceive a sense of control. This is my opportunity to be mindful. What am I noticing? If I go to the noticing part of the mind, and I am kind of bringing my awareness to notice what's coming up. Oh, this anger is coming up. Oh, this crazy thought just came up. Oh, isn't that interesting? And you do it non-judgmentally. So you're not controlling the thoughts, but you're controlling the way you respond to the thoughts. And I always teach them this one quote, a very important quote from Dr. Viktor Frankl. He said, between the stimulus and the response, there is a space. In that space is our ability to choose our response. In that choice lies our freedom and our growth. So that's when we talk about, that's the things I'm talking about there, that they control how they respond, not necessarily what's happening.
Yeah, well, and I think that's, and hence, I guess that was part of why I wanted to come back and just touch on that, because I think that's an important distinction, right? Is, when people talk about controlling thoughts, the idea, like a technique that you alluded to earlier is sort of this idea of thought stopping, right? And so sometimes I think there's some misunderstanding there where people think, okay, well, the idea is I'm going to control the thoughts that enter into my mind. And as you're suggesting, I'm not sure that's actually what the intended idea is. Really, it's sort of like, okay, there's an understanding that there may be what ifs and negative thoughts that enter into our consciousness that we don't control, but where there is more opportunity to assume or assert influence over what's happening in our mind, cognitively or emotionally, is in terms of our response to that. And as you say, to have the noticing mind gives us the opportunity maybe to take a step away from, or sort of that meta observational perspective where we see, okay, I'm aware that I'm having these thoughts and emotions. I don't have to be quite so automatic in my response, or I can be aware that, this is a belief that I have, maybe to take a pause to question that belief, to think about one's response to, and therein lies some control, right, in terms of the response. So, I know we digressed a bit in terms of the acronym, but I just thought from a practical standpoint.
I certainly appreciate your question and how you presented that an apparent maybe paradox, and therefore it required more investigation. And I actually I'm really quite pleased and I'm really appreciating very much how some of the things that I'm trying to present in ways that make sense to me and the terminology I'm using, and then when you feed it back to me in the way that you're interpreting it, I have a sense, well, I'm learning this to kind of understand this in a way that I hadn't thought about before, but it's quite a very fulfilling learning experience in this conversation so far with you. I appreciate it.
Well, likewise. And so, on to that point, in terms of the acronym TRAIN, maybe you can elaborate on what the athlete is training specifically, what they're.
Well, training, the T in active training, I think can be summed up in a kind of a phrase: train the mind to best, be the best person, the best mind you can be for the healing situation. And that requires, first of all, the reframing. Look, find something useful and beneficial in every difficult or challenging situation. Use this way of reframing it. Use an optimistic reappraisal technique. Train yourself to do that. This doesn't come naturally. Train yourself in the skills that we know. Train yourself in mindfulness and learning mindfulness and how to understand and practice mindfulness. Train yourself in imagery skills and using imagery as both as a healing mechanism, imaging the healing process, as a coping mechanism, imaging situations that are going to come up and how you're going to respond in a way that's best for you, imaging yourself back, playing and building your confidence. So the idea of reframing skills, mindfulness skills, imagery skills, and honestly, training yourself to be more just basically a good housekeeper, a good manager of your healing process by setting these goals regularly, monitoring your goals, and appreciating that that week by week you are setting a course for yourself. You're accomplishing. You're feeling a sense of success. Training yourself to look at the situation in that way. as opposed to, oh my gosh, look at poor me. Well, look at how good I feel about when I got this goal. I got my paper accomplished, which I had planned to do in my weekly goal plan, and how good that feels. Train yourself to be aware, what I call the 3 W's. Train your mind to be aware of what went well. What went well. This goes back to and I don't want to expand on this too much, but it's really trying to train the brain. It's basically training the brain to reverse what's called the negativity bias. That we know now in neurocognitive science, there's a negativity bias. 70% of our thoughts are negative, 30% are positive. Train the brain to kind of change that equation. Focus more on the things that are going well.
Yeah. And that's such a
training the mind that way.
Yeah, such an interesting point. I know there's research. Allison Ledgerwood out of UC Davis and others have done some work looking at how we become fixated on the negative, right? And as you mentioned, there's a fairly wide body, I guess, of neuroscience research that looks at how the mind becomes wired to, we have a predominance of negative thoughts, but then we also fixate. And when we do things like venting, right, where we're, maybe traditional wisdom would suggest that it's cathartic to vent, right? Mm-hmm. Get things off your chest. And while there may be some upsides to that in terms of having someone listen to us and hear us and understand us, the downside might be that when we vent, we tend to just, continue to focus in on the negative, and we don't then follow it up with, okay, well, what are we, as you said, maybe appreciative of? How can I use this as an opportunity to practice pain management, or, to then add that other element in, which is, well, what am I going to do about this? Otherwise, we probably just left feeling worse off than before we started the vent initially.
Yeah.
So
that's a good point. And that's great. Exactly what the T goes for, to train the person to be aware of that. And right. So I do educate the athletes very early on in my work with them about the negativity bias and the importance. Right. In the video series, Dr. B in 60, it starts out with a picture of a brain lifting a barbell, and it says, "Got a minute to build your brain." That's literal. That's literal. Right. If you're right. taking information that's going to give you more positive energy, make you feel more enabled, make you more capable of performing either as an athlete or as a rehabilitating injured athlete, then you've built your brain and kind of changed the negativity bias. Now you're focusing on more things that went well that you feel good about.
So to that point, Jack, do you use things like gratitude exercises? I know that's been, commonly or not necessarily, or what are your thoughts, I guess, on the potential value of things like gratitude to kind of train the mind to focus on things that went well or that one is appreciative of?
Well, that's part of the library of resources that are available for helping people train their minds in healthier and more productive ways. Again, one of the things that I do is I let the athlete lead I said, here's the library, here are the things that are available. What section of the library do you think is most useful for you to go into now at this stage, today, at this moment? And therefore, and also I use a lot of imagery work with them and hypnosis with them, so that the idea is that we're working, if it calls for gratitude. A lot of the athletes that I work with who return to play, in their mental plan, using our dear friend Terry Orlick, who's just passed on, his idea of create a mental plan for every event, and pre-competitive focus, start focus, what am I going to focus on different parts of the event, and my refocusing tool. We create that for every event that I work with as an athlete, as a performance consultant. And so in their pre-event focus plan, the athletes who are returning to play have that gratitude. They're imaging themselves. I'm so grateful. I feel so privileged to be here. They're bringing that into their focus before that event. So when we're doing that kind of imagery, yes, we're bringing the sense of gratitude in, but not as a specific thing. How it integrates into their mental plan, yes, we will.
Yeah. So there's a few more items that I wanted to touch on here.
So we're up to A, awareness, C, control, T, train, I, imagery. That's one of my favorite ones.
Yeah.
Imagery is the language of the body. If the athletes that I'm working with who are recovering and returning to play could say, if I heard that once from Dr. B, I heard it a million times. Imagery is the language of the body. And so imagery for healing, imagery for coping, imagery for, giving your sense of self of the state that you want to be in when you're performing, kind of the return to play, confidence building. In my course, The Psychology of Sport and Performance, one of the things that I think most fascinates the athletes and the coaches is the when we get into the element on confidence, the module on confidence, what the volume of literature that suggests that imaging yourself in a confident way builds your confidence. So that it's not just succeeding makes me confident. Imaging myself as feeling confident, imaging myself as succeeding builds my confidence. So it's like, wow, imagery is pretty powerful, Dr. B.
Yeah.
So imagery is the language of the body. Yeah. So that's what we want to make sure that they have that access to those tools. And actually, I do a lot of imagery with them. As I said, the communication from the orthopedist or whatever physician they're working with, having them a visual picture of when as the body is healing, what's happening, what parts are being built, what parts are strengthening, what parts are loosening. Imaging that and drawing that, and so having them image that healing process as they're going through that first stage in recovery and healing, when the body is getting ready to kind of be stronger and more capable. So
I'm gonna
the language of the body.
After we get off, Jack, there's a study by Brian Clark and colleagues that I like to reference, and I'm happy to send it to you if you're not familiar. But essentially, they focused on the role of the nervous system and how it might be involved in executing or exciting muscle and stimulating muscle. And effectively, they had in their experiment, they put individuals in a cast with their arm, and then they had one group essentially just, let them do nothing over the course of 4 weeks while their arm was casted, and the other group imagined themselves contracting their arms. And then they measured their muscle strength using a hand grip task. And they also looked at voluntary activation, so the nervous system's ability to activate muscle. And it's been shown that voluntary activation is reduced when you experimentally induce weakness. So for instance, if you put people's arm in a cast, that this voluntary activation becomes compromised. And so in a nutshell, they found that, the group that did the imagery, just sort of imagining themselves contracting, had 50% less reductions in muscle strength. And the imagery attenuated the loss of voluntary activation by about 45%. So I love studies like that because it really sort of highlights that mind-body connection that you're talking about. And it just, it's such a powerful tool for building the confidence, as you mentioned, but also like it's literally activating, stimulating the nervous system to activate muscle and to offset the muscle loss, which is so common in injury settings, right? When there's atrophy.
That's beautiful. So, I mean, that's so well precisely demonstrated in that experiment. And to go back to the literature, however, in terms of performance enhancement, and the theories, how does imagery improve performance? We know imagery improves performance. How does it work? And there's several theories. One is called muscle memory, which basically says as you image something, the brain sends the signal down the nervous system into the muscle that you're imaging yourself moving, but it's just the action potential is just not enough to activate the muscle. But you're actually exercising the whole neurological system so that when you go back to play, you've built those pathways. Going back to Hebb's work originally of as they say, neurons that fire together wire together.
Right. Yeah. So imagery definitely as a powerful tool for, as you say, maybe imagining healing or muscle function, but also for anticipating different situations or coping with difficulty, which certainly there's plenty of in the injury rehab context. Those last 2 points, value and experience, maybe you can just touch on those as well.
Well, value goes to the notion that you have discussed on other podcasts, and I think are quite an expert in illuminating for athletes the what we call the importance of post-traumatic growth. Value says, pay attention to the small victories. Today was a rough day, and I'm working with an athlete now who is really going through quite a bit in the post-surgical process. And I said, what went well? I texted her, what went well? And she texted back, well, I started physical therapy today. Now, all the other issues that she's struggling with were still there on that day that I texted her. But I said, and what went well today? And she said, well, I did start physical therapy today. So finding ways to be appreciative, and value small victories, very important in the rehab process. The other is what went well, creating this mindset, imagining yourself, what went well, as you go through a very long, rehab and recovery, sometimes months at a time. It's a struggle to have your spirits be up. It's like, wow, this is really very, very defeating, and it's so long, and I can't even imagine myself getting to the end. And so what went well is not easy to come up with all of the time. So value the fact that there are times that that it's just like there's not a lot coming up that's okay, and that's okay.
Right.
That's okay. It's okay to just, again, the Simone bias effect. It's okay to not be okay.
Yeah.
It's okay to not be okay. Value that too.
Sure.
Value the fact that this is not a time that I'm really got a lot going, and it's part of the process. It's under the dome of healing, which is the experience of the idea that when you start your injury from the very first time that you feel that injury to the time you're playing at your best, I give them the analogy of that this is called the dome of healing. That they enter into the dome, and everything that happens, every experience, every thought, every awareness, everything you eat, everything you think or feel, everything has value. It's all part of the process of traveling under that dome. And the dome is in a straight line. Sometimes you're zigzagging under that dome, but eventually you will come out and say, wow, I'm in the sunshine again. So that the entire process under the dome has value.
Yeah.
Everything has value. And so that it kind of helps, because a lot of times it's like, oh, I'm feeling down, I shouldn't be. I'm like, wait a minute, what do you mean you shouldn't be? That's happening under the dome of healing. That's supposed to be there.
Right. Yeah. So to value experiences,
a very important function.
Yeah, to value experiences regardless of, their, whether they're kind of positive or negative in nature, or the valence, I guess, of those experiences, and also to kind of see value in things, or to adopt the mindset of recognizing that there may be value in things that sometimes don't always seem valuable at the time, or but may hold relevance for the future, or and
even expanding on that, Les, even if it doesn't seem to have value, at least it's something that's happening under the dome, and I can appreciate that I'm seeing it in that way. I can value my perspective, my view, the way I'm looking at it. Yeah. And then finally, experience. And experience really is it's really kind of coming full cycle to where we started the conversation. Experience is, hey, this is your story. You write your own story. Don't let the factors in the situation or people or whatever around you define how you're going to create the story, what you're going to write in the story, how the story is going to unfold. So be aware of the fact that these experiences, be connected to the experiences, and particularly the experience, the idea of bring a sense, not only experience it, but experience it with a sense of vigor. Like, wow, what's happening here? Curiosity is such a powerful emotion. And I really like to encourage the athletes right from the beginning, be curious, especially in the return to play phase, in terms of when you first go back and you're starting, instead of saying, I should be doing this, I should stop. Just say, what's coming back? What part of my forehand felt good? Notice what's going on. Notice that, oh gosh, that's still rusty. Oh, that's got a lot of rust on it. Be curious, pay attention, notice, view it as an experience rather than saying, I have to go in there and do this with these demands and expectations. Go from the other side. What am I learning? What am I discovering as I'm going through this process? And I do share that at the very beginning, as we talked about, when I first sit down with the injured athlete, I say, this is a story that you're going to be writing, and you're going to learn an awful lot about yourself in this story. You're going to learn a lot about yourself, things that you never knew before. And that's unless you say, what am I experiencing now? Then how am I going to learn? If you're saying I should be doing this, why am I not doing that? You're not learning anything. Slow it down, open up to what am I learning? What am I discovering? What am I curious about? And that's such an important element. So the active awareness, control, train, image, value, experience, they all fit together. They're all part of one process.
Yeah. Jack, I really wish any injured athlete, and as we talked about before we started recording, athlete in the broadest sense, firefighter, first responder, tactical athlete could listen to our discussion. And I hope many do, because I really feel like you've offered so much very specific and practical and useful suggestions, insights, and ideas into framing how one can frame this injury recovery experience. And I'm sure, I know when I was an athlete and I had 3 ACL injuries and a whole laundry list of them, it certainly didn't have access to the information that you're sharing on the great wide web. And so, I really appreciate just the detail of the nuance of the thoughts and suggestions and strategies that you've shared. And I have no doubt that any injured athlete can really benefit from our discussion. Are there any things, and we've covered a fair bit of ground here, are there other things, I guess, in terms of your work with injured athletes or points that you feel are important for injured athletes to take away that we haven't touched on?
Yes, I'd like to just end our conversation by bringing in, I think, a very important element that I at some point I will engage with the injured athletes. It can be at the middle or toward the end, but it comes from a Buddhist healing meditation. And in the Buddhist healing meditation, you can engage many different elements in the beginning. May say, and may I give myself time and allow the thoughts, feelings, and awarenesses to come up that are most helpful to me moment by moment, that will allow me to navigate this difficult process. May I have strength to deal with things that are difficult. May I have optimism to find hope. May I have a sense of patience and commitment to the things that I have to endure over time. May I communicate, may I share my thoughts, my feelings, and my needs to those around me who can help understand my needs and help me benefit by that sharing. And may I care for myself with joy.
Yeah.
May I care for myself with joy.
Right.
That last concept is so critical. Yes, this is a difficult process. Bring your own sense of caring, your own sense of kindness to yourself, and care for yourself with joy.
Yeah, those are wonderful questions, I think, for any individual, whether it's injury as a form of adversity or other challenges that one finds themselves trying to navigate in life. And I think great words to complete our discussion. So I just want to say thanks so much again, Dr. Bowman, for all your time and wonderful insights. It's been a real pleasure.
It sure has. And I've learned a great deal from your reflections on some of the ideas we've shared. And I would encourage, the fact that maybe we can have further conversations in other areas that we haven't touched on today.
Yeah, that would be great.
Les, thank you so much for the opportunity to be with you here today.
Likewise.